Now we're going to move on to the trematodes, or the flukes, in which the snail, shown here, are the intermediate hosts for the infections. Eggs are going to be extremely important here for diagnosis, and of all of the flukes, the schistosomes are going to be the most high yield. Now we're going to first talk about the intestinal schistosomes, and although there are two species listed here, Schistosoma mansoni and japonicum, the one that's usually tested is mansoni, and I'll tell you why in just a minute. How do you acquire schistosomes? You swim or you are around water that's contaminated with schistosomes, and they penetrate intact skin. One of the ways could be when you're swimming in infested water. Another scenario that they can give you is people that work in rice fields, because they are in standing water in the rice fields, and the schistosomes, again, can penetrate the intact skin. The reservoir host are, again, domestic animals or livestock like cats and dogs, and then cattle, for example. This, as you can see in these kids, causes major hepatomegaly. All right? What happens is the organisms penetrate intact skin, they mature in the mesentery, and they cause a granulomatous response in the liver, and you get the hepatomegaly in those chronic cases, like was in that image that we showed in the previous slide. Now, the reason I said Schistosoma mansoni is most likely to show up is because the egg, which I'm circling now for mansoni, is unique and diagnostic. The egg has what we would describe as a subterminal spine, okay? And if you look at the egg for japonicum, it looks like a lot of other eggs for a lot of other parasites, so it's not what we would call unique. Whereas the egg for Schistosoma mansoni is considered unique. So even if you had no idea about the disease and you saw that egg, you should be able to answer Schistosoma mansoni. Now, the way that I'm going to help you remember as far as the egg and diagnosis going along with the organism is if you can remember Schistosoma mansoni with the S has a subterminal spine. Mansoni, subterminal. So the diagnosis is by looking for the eggs in the stool, and we're going to treat it with praziquantel. Now we're going to look at the vesicular schistosomes and talk about Schistosoma hematobium. Now the egg is unique, just like with Schistosoma mansoni, so you should be able to identify the egg. The egg has a terminal spine. So Schistosoma hematobium, with a T, hematobium terminal spine. That's how you're going to remember which egg goes with which of the schistosomes. How do you acquire them? The same way that you acquire the others, penetration of intact skin. In this case, the vesicular schistosomes, the host, are primates rather than livestock and domestic animals. Again, very similar. The organisms are going to penetrate intact skin, but now they mature in the bladder veins. And what happens is you get hematuria, and in areas of the world where this has a high incidence, they will actually refer to this as male menstruation, because when a male gets it and he has the hematuria, clearly you can make the connection there. Now, chronic infections in areas of the world like Egypt and Africa, Schistosoma hematobium is associated with bladder cancer. Okay? Now, what did I say in Chapter 2 when we started talking about infectious agents that were associated with cancer? I said it was really important to note those, and that bumps them up to a little bit higher yield, right? So far, the only agent that we've talked about like that was Helicobacter pylori and gastric adenocarcinoma. So now you have another one to add to the list, Schistosoma hematobium with bladder cancer in Egypt and Africa. How are you going to diagnose it? You're going to look for the eggs, again, in the feces, and note that hematobium has a terminal spine, okay? And you're going to treat it with praziquantel, just like we did for the intestinal schistosomes. Now, there's a group of schistosomes that we're calling non-human schistosomes, and this is a common theme that you're going to find throughout the parasites. What happens is we are not the host, the definitive host for the non-human schistosomes. They like to go into birds and other animals, but humans were not meant to be the host. So we're swimming, they penetrate our intact skin, and now they're looking around and they were supposed to be in a bird and they're in you, and they don't know what to do. They can't complete the life cycle. So in this case, they just produce this intense dermatitis. They can't complete the life cycle because they're out of their normal host. So with non-human schistosomes, what you're going to see is something called swimmer's itch, where you get intense dermatitis at about 2 to 3 days after the acquisition of that infection. So treatment, you can give an antiparasitic, but also calamine lotion to control the intense pruritus, and sedatives actually, because the itching is so bad. All right, so that's an example of when you have a parasite that normally belongs over here, but somehow gets misguided and now gets into a human and can't really complete the life cycle. We're going to see several other examples of this as we continue to talk about the parasites. Now, the next flukes that I'm about to talk about are really low yield. So I'm going to mention just a couple of things about them. We're not going to spend a whole lot of time on them because they're really extremely low yield for step 1. Okay? Now, Clinarchus sinensis is also known as the Chinese liver fluke, and it is associated with the ingestion of raw fish. So again, you know how we get it. We'll talk about the disease, and then we'll talk about diagnosis. All right? The adult worm is pictured at the top, and sometimes in individuals that are infected, I've actually seen, I can't remember if this was on YouTube, but somewhere on the internet where they showed somebody going in and doing a manipulation of the gallbladder, and they showed all the worms come out of the gallbladder. So that's actually fairly unique. You're not going to see that very often. Most of the time the diagnosis is going to be from the eggs. Okay, the disease is a serum sickness-like disease. Do you remember what serum sickness is like? Serum sickness, you get kind of a vasculitis, a rash, a fever, and you're going to diagnose it by eggs in the feces. So let me go back. Look at the egg again. The egg is described as an egg with an operculum, which I'm circling at the top, which basically means it has a lid. So you have an operculated egg that's unique to Clinarchus, and that's going to be diagnostic. And again, we're going to target this with praziquantel. We're going to treat it with praziquantel as we did the other schistosomes. Fasciola hepatica is the sheep liver fluke. You get it from ingestion of aquatic plants. And the disease can be varied from subclinical or asymptomatic to fever, night sweats, and malaise. Okay? And you're going to diagnose it again by eggs in the feces and treat it with praziquantel. And again, there's nothing really specific that stands out here. But again, in the vignette, they might mention some history of eating watercress, for example, that might help you in this direction if they happen to put it on there. But again, these are fairly low yield. Fasciolopsis buski is the giant intestinal fluke. So you can see how wide and flat and kind of fleshy it is. You also get this from ingestion of aquatic plants, in particular water chestnuts. So if you like your Chinese food like I do, don't let that ruin it for you. The disease for fasciolopsis, again, is most of the time asymptomatic, but can be nonspecific abdominal pain and diarrhea. Eventually, it's going to get diagnosed by looking at eggs in the feces and is also treated with praziquantel. All right, Paragonomus westermanni is the lung fluke. This is the only parasite that actually really targets the lungs. Most of the other parasites that we're going to talk about use the lungs to get to other places in the body, but they do not target the lungs like Paragonomus. We acquire Paragonomus through eating undercooked crabs or crayfish. The reservoir host are humans and domestic animals, but also farm animals such as pigs. The disease itself can mimic tuberculosis. So you're going to get a lot of inflammation in the lung. You're going to have hemoptysis, coughing up bloody sputum, and you can actually find the organisms in the sputum, but you can also find eggs in the feces, and that's typically diagnostic. Also, we're going to treat this fluke with praziquantel. Okay, so for the flukes in general, schistosomes are by far the most important, and those last few that we went over are really low yield, so we're not going to focus on those as much.